po namin Diyos. Maraming salamat po sa buhay at lakas na aming taglay, sa liwanag ng kaisipan at sa pagkakataong maipagpatuloy ang pag-aaral ng mga kabataan. Gabayan po ang bawat isa sa amin. Anuman ang bahagi na aming gagampanan, naway maging maayos at matagumpay ang pagtuturo at pag-aaral na aming gagawin sa araw na ito. Patawarin mo po kami sa aming mga pagkulang at pagkakasala. At sa aming paggawa, ikaw po ang aming makasama. Amen.
Hi everyone, and welcome for today's session. Here we are again for a fun learning experience, and I'm excited to share with you the insights about communicable diseases, prevention, and control. Come and join me in Valenzuela FLI. I'm RENATO CABANGANAN from GEN.T National High School, your health teacher. I would like to go over a few items so you will know how to participate in today's discussion. Here are some reminders. The next thing I'll share with you are the most essential learning competencies. So allow me to give you the competencies that you are about to learn. By the end of the lesson, you'll be able to analyze the nature of emerging and re-emerging diseases, demonstrates self-monitoring skills to prevent communicable diseases, promotes programs and policies to prevent and control communicable diseases, identifies agencies responsible for communicable disease prevention and control. Disease prevention and control is a very important health concern because it affects the quality of people's life. Communicable diseases not only threaten the sick person, but also his, her family, and the society in the general. To start, let's have a short activity to recap on what was discussed on the previous FB Live lesson. We have a game called Pick a Door. Let's pick a door. Identify the following. You have 5 seconds to type your answer in our comment box. I hope that the instruction is clear. Are you ready? Let's begin. Door number 1. A small, simple life forms 1/2 to 100 the size of the bacteria, these organisms are the human body's worst enemies.
5, 4, 3, 2, 1.
Time's up.
0.
What do you think is the answer? If your answer is virus, you are correct. Very good. Let's open the second door. These are the simple organisms that cannot make their own food.
5, 4, 3, 2,
Time's up.
0.
Are you excited to know the answer? The answer is fungi. Keep up the good work. The next one becomes even more exciting. Door number 3. One cell microscopic organism that rank among the most widespread of living things.
5, 4, 3, 2, 1.
Time's up.
0.
The answer is bacteria. You're doing great. To those who got the wrong answer, don't worry. You still have a chance. I hope everybody's participating. Let's open the last door. Door number 4. A single-celled organism that are larger than bacteria and have a more complex cellular structure.
5, 4, 3, 2, 1.
Stop. What do you think is the answer? The answer is protozoa. I hope everybody enjoyed our activity today. Thank you for your participation. This presentation will introduce you to the nature of communicable diseases and its prevention and management. To build up the energy and excitement and give overview of today's topic, we have another activity called Plus Figure. In this activity, you need to give the appropriate descriptions of the following. You have 30 seconds to type your answer in our comment box. Your time starts now. Time is up. Let us reveal the answer. A, germ. B, source of germ. C, transmission of disease. D, infected. And for letter E, how disease infects. Again, thank you for your participation. Great job, everyone. There is a popular saying, prevention is better than cure. If you lack self-discipline, then prevention and control of diseases will be difficult to attain. The first thing that we need to discuss is all about emerging infectious diseases and re-emerging infectious diseases. What are emerging infectious diseases and re-emerging diseases? Emerging infectious diseases are diseases that have not occurred in human before. This type of emergence is difficult to establish and is probably rare. Have occurred previously but affected only small numbers of people in isolated places. Have occurred throughout human history but have only recently been recognized as distinct diseases due to infectious agents. Re-emerging diseases are diseases that reappear after they have been on significant decline. Re-emerge may happen because of breakdown in public health measures for diseases that were once under control. They can also happen when new strains of known diseases or disease-causing organisms appear. Human behavior affects re-emerge. Re-emerging diseases include malaria, tuberculosis, cholera, influenza, and gonorrhea. Re-emerging infectious diseases are diseases that are once were major health problems globally or in a particular country, and then decline dramatically, but are again becoming health problem for a significant proportion of the population. Many specialists in infectious diseases include re-emerging diseases as a subcategory of emerging diseases. Emerging and re-emerging infectious diseases are unpredictable and create a gap between planning and create action. To address this gap, there is a need to come up with proactive systems that will ensure preparedness and response in participation to negative consequences that may result the pandemic proportions of diseases. Here are some social determinants contributing to the emergence of novel infectious diseases and resources of control or eradicated infectious diseases. These contributing factors are namely: 1. Demographic factors, like the population distribution and density. The global demographics and distribution of human populations are rapidly changing and will continue to evolve. These factors, perhaps more than any others, are contributing to the globalization of infectious disease problems. 2. International travel tourism and increased OFWs. One way in which travel helps infectious diseases to spread is by the instruction of new microorganisms into a new geographic area. 3. Social economic factors. Social and economic factors such as income, education, employment, community safety, and social support and significantly affects how well and how long we live. These factors affect our ability to make healthy choices, afford medical care and housing, manage stress, and more. For number 4, we have environmental factors. Climate has affected the timing and intensity of disease outbreaks throughout history. Now that you're familiar with emerging and emerging infectious diseases, you're ready to explore the self-monitoring skills to prevent communicable diseases. What are their preventive measures? Let us enumerate one by one. Perform hygiene properly. Use your own personal things. Maintain good ventilation. Keep away from sick people. Eat clean and well-cooked food. Maintain environmental cleanliness. Follow these guidelines to reduce the spread of infections. Preventive measures. Adopt proper isolation for the sick. No human contact. Keep both hands clean and perform hand hygiene properly. Clean and disinfect properly the items used by the patients. Do not share towels and other personal items. Wear gloves when making contact with patients. Ensure all food is adequately cooked, especially high-risk food like shellfish. Perform hand hygiene before meals and after going to the toilet. Handle vomitus and excreta properly. Maintain environmental hygiene to prevent breeding of insects, mosquitoes, prevent accumulations of stagnant water. Take personal protection to prevent insect mosquitoes bites. Wear light colors, long sleeve clothes, and trousers, pants, and use insect repellents. Maintain good indoor ventilation. Keep both hands clean. In particular, perform hand hygiene properly and immediate after making contact with sick persons having respiratory secretions. Cover mouth and nose when sneezing or coughing. Use tissue paper to contain respiratory secretions and dispose them in garbage bins with the lid. People with respiratory infection symptoms and their close contact age should wear surgical masks. Seek medical and advice immediately in unwell. I hope everything is clear now. Let's observe, reflect, and react. Which of these prevention tips do you strictly practice and why? Why is its effect to you? Which of these preventives do you hardly practice and why? Why is its effect to you? The topic is becoming more exciting. Let us continue. Health promotion programs aim to engage and empower individuals and communities to close healthy behaviors. What are some government programs and policies to prevent and control communicable diseases? Let's find out. 1. Adolescent Health Development Program. Targets adolescents aged 10 to 19 years. It is mainly guided by the Convention on the Right of Children, which states that the program was in the best interest of the child. The program primarily aims to provide adolescent access to quality healthcare services. 2. Aedes-borne viral diseases prevention and control program. The prevalence of Aedes-borne disease, such as dengue, is still a significant problem that the country faces. 3. The Universal Health Care Act mandates institutionalization of health technology assessment. 4. Breastfeeding awareness. 5. National Family Planning Month, usap tayo. 6. Res bakuna, kasangga ng vida. 7. Vida solusyon. 8. Barangay Nutrition Scholar Program. And number 9, operationalize the integrated primary care for the following flagship programs. reproductive, maternal, newborn, child health, nutrition, oral health, national immunization program, and the National Tuberculosis Program and National AIDS, STI prevention and control program. The next topic to discuss is agencies responsible for communicable disease prevention and control. Disease and Prevention and Control Bureau of Department of Health. A. Infectious Disease Office. B. Degenerative Disease Office. C. Family Health Office. D. Environmental and Occupational Health Office. I provide you with an activity that will enhance your understanding about our topic. What do you know? In your activity notebook, draw your palm and fingers. Recall the helpful things that your parents have done to you since you were baby up to the present in order to prevent you from getting sick. Write one on each finger, the common and the vital practices that your parents have done to you. Don't forget to submit your activity to your Mapeh teacher. To sum up our topic, but every day to keep your skin, hair, and nails clean. Avoid sharing personal or drinking utensils. Store and prepare food in safe way to prevent food contamination. Wash your hand after using the toilet and wash your hand before and after eating. If you are sick, avoid sharing your sickness to others. Cover your nose when sneezing. Infectious diseases have an ever-increasing importance worldwide, not only because of remarkable emergence and the emergence of pathogen, but also because globalization and population mobility have forced our realization to have global health. Because pathogen do not recognize national boundaries. The rapidity with which individuals can circumnavigate the global incubating infectious makes infectious diseases an enormous challenge for governments and for the public. And that concludes our lesson for today. It's now time to see if we have learned something from what we have discussed. Please respond to the following statement by typing check or X in the comment box. Statement number 1. Cover nose when sneezing and use tissue papers to contain respiratory secretions and dispose them in garbage bins with lid.
5, 4, 3, 2, 1, 0.
Time's up. The answer is check. You are doing great. Statement number 2. Health promotion program aim to engage and empower individuals and communities to choose healthy behaviors and make changes to reduce the risk of developing chronic diseases and other morbidities.
5, 4, 3, 2, 1, 0.
The answer is check. Keep it up. Statement number 3. Keep one hand clean and perform hand hygiene properly.
5, 4, 3, 2, 1, 0.
Stop. The answer is X. Amazing. Let us continue. Statement number 4. Emerging infectious diseases are diseases that occurred in humans before. This type of emerge is difficult to establish and is probably not rare.
5, 4, 3, 2, 1, 0.
Time's up. The answer is X. You are in the right track. Keep working on it. Let us proceed to statement number 5. People, animals, food, surfaces, and air can all be carriers of the microorganism that pass infectious illnesses from one host to the next.
5, 4, 3, 2, 1, 0.
Time's up. The answer is check. Did you get all the answers correctly? I do hope so. Congratulations for a job well done. Always remember, take care of your body. It's the only place you have to live in. The time for action is now. The global strategy for dealing with the emerge and re-emerge of infectious disease threats throughout the world must be developed and implemented as soon as possible. Once again, this is Renato CABANGANAN, your health teacher. Stay safe, everyone. Have a good day. See you in our next Happy Life. Bye-bye.